All right, here's the down and dirty. If you're looking for supplements to combat addiction, you're not really in luck because there really aren't any. But if you're looking for things you can take to combat addiction withdrawal, here are 3 things that you can take. Number 1, NAD. NAD is basically your cell's fuel converter. It helps turn the food that you eat into energy that you use. Without it, your cells can't do their job and they start to break down, leaving you sluggish and fatigued. NAD is also involved in dopamine production. We all know that dopamine hits are what we're chasing when we're dealing with an addiction. When we quit using whatever substance we're addicted to, the brain feels like it's dopamine depleted. By taking and utilizing NAD as a supplement, we can maybe give our brains some extra baseline dopamine when we're feeling depleted of it, thereby reducing cravings or the need to chase dopamine hits. There was a small study that was done to determine this, and the researchers used NAD given through IV therapy to get the effects. So do consider that. But the research outcomes showed a significant reduction in substance cravings, anxiety, and depression for these people who are coming off of multiple addictions that they were withdrawing from. Chronic substance use and addiction also depletes our brain's natural amount of NAD anyway. So if you're coming off an addiction, you really should supplement with NAD no matter what. Number 2, low dose naltrexone. This is a prescription that was originally intended to be used for opioid and alcohol withdrawal. In low doses, like 1/10 of the dose that you would prescribe normally, it seems to help the immune system and reduce inflammation. It blocks some of your opioid receptors temporarily, which allows you to make more endorphins, which combat inflammation and help your immune system at the time. Some smaller studies have tested using low-dose naltrexone in alcohol use disorder and behavioral addictions like gambling and binge eating, and have shown an associated reduction in cravings and improvement in emotional regulation and less depression. Number 3, NAC, N-acetylcysteine. N-acetylcysteine is a natural antioxidant and a precursor to another antioxidant in our bodies called glutathione. Glutathione is stored in your liver and is largely responsible for detoxing acetaldehyde. Acetaldehyde is the breakdown product of alcohol use and is responsible for giving you that hangover feeling. If you have a hangover and you get glutathione supplementation, you can get it through an IV, you can take it orally, you can combat some of those hangover symptoms. For somebody who's trying to come off of alcohol, it's a really useful supplement because it helps you feel better in general. Now, NAC also works with something called glutamate in creating neural pathways. So hammering in the roads that your brain takes from A to B, and when you have addictions, you create new neural pathways that tell you that whenever you're stressed out or happy or sad, that the best thing to do is to reach for that substance or that addiction. So it takes time to create these neural pathways, and then when you quit your addiction, you have to basically repave new pathways. NAC, N-acetylcysteine, helps modulate something called glutamate, which is involved in creating those neural pathways. So if you're coming off of an addiction and you need to create new neural pathways, taking NAC can help you accomplish that. So those are 3 things you can consider taking if you're going through addiction withdrawal. I really think they're worth looking into for anybody coming off an addiction. NAC and NAD are over the counter. As a bonus, glutathione is over the counter too. You can get injections of all of these things. You can get them orally. You can take them IV. Low-dose naltrexone is the only one that you need a prescription for. You can ask your doctor for that. It does have to come through something called a compounding pharmacy, or you can use online telehealth programs to get a hold of low-dose naltrexone and see if you qualify first. But there you have it. Those are 3 things that you can take to combat substance use withdrawal.